So let's talk a little bit about detox and yeast, the overgrowth of what's known as Candida, or it's a fungus. There is a fungus among us sometimes. So let's talk a little bit about yeast. I know my humor is really corny. So we have systemic yeast, which can cause a variety of symptoms, and it can be something as simple as feeling bloated in your bowels after eating. Some women might experience vaginal yeast infections. There can also be experiences of fungus on the toes and on the fingernails. What's important to remember is that detox is a detox process, a general detox is wonderful that you can do. Like I said, there's plenty of programs that list a combination of juices and herbs. Again, there's no cure-all combination of fruits and vegetables. My greatest tip for you is just vary. Have a variety, because each and every plant has a whole spectrum of beneficial components. But in addition to that, there are some pre-existing conditions that you really need to be mindful of, which may have a predisposition to things like yeast. Diabetics often have an issue with yeast. People undergoing chemotherapy, because chemotherapy is often very high doses of antibiotics. And so people who have chronic infections like chronic bladder infections and chronic ear infections and chronic sinus infections are often taking antibiotics on a regular basis. And because the antibiotics kill off all the bacterium, the good and the bad, and by that we mean the bacterium which we don't respond well to. We have good bacterium and bad. We have an imbalance caused by chronic antibiotic use. So we can have a heyday of yeast when it overgrows because the good bacterium don't keep it in check.